All right, hello everybody. Welcome to Lucas Podcast again. You're here for this series that is actually going to be giving you more information about the pharmacy course and, of course, how's life in the working world as a real life pharmacist. So we have two very special guests today. We have Dave and we have Chok Tong today, right? Both pharmacists in their very own right to actually give us some guides, some tips, right? Some info about the pharmacy course as well as the working life as a pharmacist. So before I go any further, let me introduce you to Dave and Chok Tong. Dave?
Okay, hello everyone. I'm Dave Ng. I think you have saw me before in the previous podcast for stress management. I'm actually working currently as a pharmacist, of course. Actually, I studied for my pharmacy course in Monash University in 2011 to 2014. Then I did my housemanship in Klang Hospital in 2015. Then I did my compulsory service from 2016 onwards till now at the General Hospital in Kuching.
Chok Tong?
Hi, my name is Chok Tong. I graduated from University of Nottingham in 2014. I did the 2+2 course, so 2 years in Malaysia and then 2 years, the final 2 years in UK. Then I did my 1 year of pre-registration in UK. After that, I went to work in a hospital in Singapore for about 5 years. And then now I'm back in Malaysia in a retail setting.
Right, thank you. And welcome to the podcast, right? So yeah, Dave and Chok Tong, you were my students like a lot of years back. I think 11 years already, I believe, isn't it? Correct? Year 2009. Year
Yeah.
2009.
Yeah.
You were actually studying A levels back then, right? Such a long time already, isn't it?
Super
That's why I know the
long.
class code. The class code is 0903 PM10.
Yeah, exactly. You still remember?
Wow, still remember.
Dave was also our class rep back then, right? Isn't it? Right? The class was huge for a March intake. For an express course, that was a huge class, isn't it? Like about high 30s, 30, 31 and 32 when we started, if I'm not mistaken.
It was equivalent to the January intake there. Yeah,
Exactly.
it was quite
It
large.
was quite a large group, and among that group, right, I know that there were a lot of you who actually studied pharmacy after graduating from A levels. I would say like about almost one third of the class, right, who actually studied that particular course, right? And I'm very lucky to actually have both of you, very honored to have both of you to be in my podcast today. So I think today's session, you are actually going to actually help a lot of aspiring students who actually wanted to actually apply for this course to get more information, not only just on the course, but also how is it like in the working world as a pharmacist. Now, Dave is actually from the government sector, right, in the hospital. Chok Tong is actually in the retail. Chok Tong also has some experiences working in the hospital as well back in Singapore. Your experience in Singapore. So, so let's get this started. So, pharmacy, right? Is there any kind of prerequisite required for a student to actually enroll in this particular course? Now, I know that surely the student will have to actually take up a PU course. Like, for example, for both of you, you took your Cambridge A levels, correct? Right? Is there any like particular subjects that the students actually have to be strong in order for them to actually apply and do well in this particular course?
I think for pharmacy in general, they should be strong in at least the two main core subjects, which were the biology and chemistry. They do need to be good to a certain basic degree of mathematics. I think that's the three main prerequisite for most of the universities and college, I think. Then maybe some university and college may require certain English requirements that will depend on certain what's their requirement require. It could be MUET or all of them around that. Or maybe the O levels SPM as well could be.
Mathematics. Now, bio and chem, I understand, but maths, you need maths as well in order to do that particular course.
Yeah, maths important. Like in our daily work, especially when you count dosage, conversion from one, like for example, milligrams to grams. Simple maths are no need. Like those maths we learn in SPM, no need so complicated. simple maths. Yeah.
I think the AS level will do. The AS level will do. Just have to, because I think we
Yeah.
do deal with pediatric doses and they are based on weight base. So we have to do certain calculation to get to that dose. Yeah.
Yeah, now I come to think about it. Yeah, you have like to provide medication for different person with different body masses. Am I right? Weight.
Mm.
Right? So therefore, you have to be careful and actually measuring the amount that you're actually giving to them. Yeah, yeah, that makes sense. That makes sense. Okay, right. So that is the maths. You need of course also bio and chemistry, right? In order to actually do well in this particular course. So how's the study pathway like? Yeah, for this particular course, right? Do you actually like study locally do you study abroad totally or is there any other options available? Dave, how was your experience in a study pathway for this particular course?
So after A levels, I took up my pathway was to do at Monash University, Malaysia. So mine was actually a 4-year full in Malaysia, the course itself. So, I didn't need to go overseas at that. It was a full 4-year course completed here as well. Yeah.
What about Chok Tong?
I did 2+2. That time, the Nottingham campus in Malaysia, they did not offer the full 4 years in Malaysia. So the only option is to do the first 2 years in Malaysia, and then the third and fourth year we have to go to UK to complete it, and then the cert will be by the UK campus.
All right, so is there any differences between like what Dave did here? You actually completed your studies here in Malaysia, whereas Chok Tong actually did a twinning program. Is there any differences?
There's not much difference because the lecturers from the UK, they do come over here to have their lectures in our local campus as well. So they do switch, how to say, they transfer their lecturers between these two campuses as well. So courses syllabus are the same. Yeah, basically.
Yeah, this also applies to Monash as well because we have the Australian degree and the Malaysian degree. Yeah, we do have their lecturers coming over, and sometimes our lecture also going to there. So actually, the whole course and notes and everything are actually the same. Just however, the degree recognition could differ though. If you finish up in Malaysia, then maybe the degree is only recognized in Malaysia. Whereas if you finish in Australia, it is recognized in Australia. But I think over time they may go through the Commonwealth recognition. So it really depends. Yeah.
So I think at the end it doesn't really matter, right? So yeah, so how is it studying like? You know, the course, the pharmacy course, the 4-year course. How is it studying like? Can you like briefly explain to us what you all have to do from year one all the way to the 4th year of your studies?
Think year one was pretty much the foundation itself. So I think if you didn't study much during the foundation, then I guess that's your second chance to study back every single thing, most of the basics like the maths, the chemistry, the biology. So the first year was to make sure everyone reaches the same level before we go up here to the second, third, fourth year. The second year onwards will be much more depth and there'll be more application to what you have studied so far the first 2 years therapeutics and how to apply on real life situations, scenarios. So I guess the second, third, fourth year onwards is the real game as well. First year was just it's just starting all over and learning the foundations. Yeah. I think it could be different for Chok Tong though, so maybe we can ask him his opinion.
Yeah,
What
I
about Chok
think
Tong?
different uni they have different syllabus, like how, their sequence, how they are like. But basically, is what Dave mentioned. Uh, Roughly, the flow is like that lah. But my uni during the second year is more on like compounding, lab work. Then third and fourth year they go into more specialized. Uh, they train your clinical skills and your clinical knowledge. Yeah.
So first year basically they're still teaching still the foundation stuff lah. So our Cambridge A levels, the one you guys have graduated from, right? We have a lot of depth in our bio and our chemistry, correct? Right? So do you think our A level students, Cambridge A level students, actually has a certain advantage going into this particular course?
For knowledge wise, I guess they may have a head start, I would say. into the course. However, you have to got to know also that A levels we hardly do any coursework. So I guess the coursework we are lagging behind, whereas compared to the SAM, OSMED, or maybe certain foundation. Knowledge wise, I think you'll be pretty much ahead with the STPM students as well. I think STPM is probably the most ahead one knowledge wise. Then, but I guess the first year it wouldn't matter much which foundation you took. Everyone will reach off with the same start anyway. So it's just a matter on you making the effort to study up
Yeah.
and catch up. Yeah.
Yeah. Have to put in effort no matter what.
Okay, so it doesn't matter lah. So anyway, because first year is like bringing all the students from different backgrounds, from different qualifications back to the level where everyone is actually supposed to be at, so they can actually move on with their studies. Okay, so which is the most challenging years, among the 4 years that y'all put in university?
Mine
Which
will
is the most
be
difficult year?
mine will be the fourth year because that's where the most assignments, most OSCE. I think later Chokta will explain what's OSCE about. uh, Assignments, deadlines, a lot of application, attachments as well. So it was there were plenty of attachments towards the final year. So I think those were the toughest one I ever had lah. I think the first year was the probably the easy one you could say. Second, third year was trying to adjust yourself, but fourth was really the worst of all. Yeah, and final year assignment. So yeah.
So
For me, it will be the third year lah, because I need to juggle my studies and my because it's my first year overseas, so I need to juggle my daily life as well as my studies. So it's the most challenging for me. Yeah, and then yeah, like Dave mentioned, OSCE was my during my second year. One is my fourth year. Fourth year is when they train your dispensing skills lah. That one is more into detail. Second year was more on the surface, touching the surface, where they test your second year more on how the way you talk rather than your knowledge. But during your fourth year, they will test your knowledge also. So uh, throughout the years, I think it gets harder and harder lah. The first year is the easiest.
I'm not so surprised seeing Dave saying his fourth year is difficult because fourth year, the last year for me is literally the most difficult one because there's like so much to do, so much to accomplish within the last year. But Choto actually mentioned third year was also particularly challenging because you need to settle in a new
Yeah,
environment.
I need to
The acclimatize adjustment for him. New time
Yeah,
zone.
not easy being away, right, from home, and somehow it's actually a new country, not near, quite far away from the UK, correct? So that was actually another thing that our students need to actually be adjusted to whenever they go to a new country. So yeah, and Chotong, just now you were mentioning OSCE. Dave also was it OSCE? What was it about? What is it in particular?
OSCE actually stands for, I think, Objective Structured Clinical Examination. I think it's related to, they will put some scenarios for you with live human being, giving you some difficulty and you trying to use your clinical knowledge to overcome them. Maybe there are certain difficult patients they may throw at you, which are all just acting purposes only. But you
yeah,
will try
it's an
to,
actor.
it's all an act, you don't know, right? Nothing is real there. It's just that you are assessed on how you handle the situation and try to give the best management for the particular patient. Yeah.
I see, I see. So do you guys do this often?
For me, it's done every semester almost. After the second year, I mean the second year onwards, towards the second half of the second year onwards, I think it prepares you for the life outside. Though it's not 100% real because it's controlled environment. Just maybe the words you may say and how you handle the situation. Yeah, but maybe Chokta may have other different experience. Yeah.
For me, twice only lah. Second year and my fourth year. But we do have like classes on teaching you how to better counsel patients lah. Then OSCE is more of like an assessment already. It's like an exam style where they will grade you lah.
So it's like they're putting you to go through the application.
Yeah.
All right. Okay. So who should apply for this course? Yeah,
Should apply. I think I mean pharmacy courses. I
pharmacy
think
course.
people who I think at the start maybe people would think maybe people who are interested into chemistry or biology. I think that's a typical generic answer. But I
Yeah.
think as time progresses, you gotta be the one who is passionate to make effort for the patient. Try. I mean, they will really want to counsel the patient, have the passion to do it. I think that is the one who will be the one keeping you surviving in the pharmacy life as well. I think the cost, I think the cost is probably the easy part of it. Is I think is you trying to handle yourself after graduating it. I think that's the harder challenge and to keep it up for maybe the rest of your life till you finish pension or retire. Yeah. But I think that's yeah, the people who are passionate in trying to treat people. Yeah.
What about Chotong?
I think you need a lot of patience also in this field because you are dealing with the public, the people, the patients, their family members. A lot of emotions are involved. So you need to have a strong mentality and high patience when you have when if you are considering this job scope. Yeah.
I think I experienced this during your OSCE, practices, throughout the semesters, like what, 30?
Mm,
I think the
not
hosting is quite
not
controlled, not so much. I think hosting you
yeah.
just think is one off, two off, and you don't. Maybe some of us won't take it even seriously, so because those are not real patients. But actually, the real patient out there, I think, are far more challenging, far more emotional. I think they have more
Yeah.
their own drama itself. So yeah, trying to handle those and still give a professional answer and professional service. I think that's a challenge, like yeah.
Right. Interesting. Yeah.
Yeah.
So it's just definitely more difficult to deal with the actual
Yeah.
person, rather than whatever that is set up for you guys during the course. All right. So what about job exposure? Any kind of placement or attachment that you guys have to actually go through, right? Before you all graduate from the course, because you need to actually have a taste of how is it like working as a pharmacist, maybe in the hospital or maybe in retail, right? So is there any kind of opportunity provided to you guys to do attachment or placement before you graduate?
For me, in my course in Monash, they actually gave us to do placements. It's part of the course requirement. It's one of the prerequisite inside the course itself. So we were given 4 placement to do. There were 2 hospital placement. There was 1 retail placement and 1 clinic kesihatan placement in the course itself. So I guess when you're doing that, I think you will kind of know whether how's the real working life in the general hospitals or district hospital and the clinic kesihatan and the retail. So you kind of get the exposure of how's work life, or is that your interest, or is that what you want to do after this? I think those were really requirement for us, but it was also an eye-opening experience on how they do their work and so on. So maybe Chok Tong had other experience in UK, maybe we can ask him as well.
Yeah,
I
Chok
think
Tong?
my during my time, my uni did have some attachment, but I think not as much as uh, Dave's uni. Mine is only like a few, uh, maybe about 2 to 3 days attachment with the hospital. Nottingham is attached to the is a teaching attached to a teaching hospital next door. So they do arrange you maybe uh, two to three attachments. Each attachment is just like for 1 day. Then yeah, that's about it. The attachment that they're going to arrange for you, and then for during holidays like summer holidays, you can take initiative to apply for further attachment for your respective institution. For example, you want to know more about retail, then you can apply or inquire whether such place they do accept placement or not, or maybe just for 2 3 weeks placement, those kind of thing. But that is at your own initiative lah.
What about current student in UK? Is it compulsory for them to actually do attachment
Current,
or
I
or they
I
graduate?
think currently the format has changed where it's compulsory to do this placement and the uni is arranging it for them. Yeah.
So I think it's very important to actually do this kind of placement and also attachment,
Mm,
because it actually exposes the student to the day-to-day job of a
mm,
pharmacist, right? So then from there you will know whether you are suitable for to work in this field or not, right? So
mm,
yeah, I think it's quite important because recently I saw one of my students on Facebook. She basically detailed off her experiences, right, on the attachment in a pharmacy in the UK, right. So yeah, she was also mentioning that it's a part of a requirement, right, for her to actually graduate from the course. And it's good to know that universities are actually arranging this kind of experiences for our graduates so that they're more ready for the actual world, right. So yeah, I think it's a good thing. It's a good thing. So is there any what they call this good experiences that you want to share from your placement?
I think
Every one of them is different, isn't it? Correct? I'm sure you
yeah,
guys have
every one of them
different.
is different. The district one were interesting for me. It's the first time to go to a district area on how to handle those kind of patients. It's quite a simple life there though. The patient, yeah, it's just a different type of patient at different settings. I think that is the interesting experience for me, and the type of disease or management as well. I think a different geographic location may have different kind of cases. Then the retail, of course, is very different to the government setting, which I went. It's more about business setting, margins. So yeah, those are very, very different experiences. So it depends on what you really want to do and what you like lah, from there. I think you will know from there.
yeah.
Okay.
I think my experience also similar to Dave's, but I think the main difference from when you're actually studying and coming out to work is you realize that what you study may not be actually applicable in real life. Not 100% because like they mentioned, every patient is individual, so we have to take into account the patient's particular condition before we can decide on the proper management. So although what we learn in uni, for example, the first line treatment for this patient is drug A, but then when it comes to patient A, drug A may not be suitable. So we cannot direct copy paste what we learn in uni into real life. And one thing you need did not take into consideration the cost. So in real life, the patient may not be able to afford drug A also. So that may be a factor into choosing drug B instead lah. So all these factor in real life, there's a lot that influence your treatment choice. Yeah.
The kind of
So
options of drugs to be given to the patient, I think it's more on the retail part, or and also maybe in the private sector, right? Because not so in the government sector, right, Dave?
Government sector, not really. Anyhow, I just want to emphasize what Chokton said. I think in university, what you study is based on ideal situation. Yeah, in real
mm,
life, it's very much on trying to compromise and give the best service you can. Yes, in the retail and private service is based on what you can pay, or maybe what the insurance can pay. That's the best service they can find. And I think most of the private retail, they may be able to give you the original, the pioneer brand as well. Whereas in the government setting, we do try to give the best treatment possible. However, ours is on a cost management side. So if we can find a generic option, then we will give you the generic option over the pioneer brand. However, they are actually biosimilar. Just want to emphasize. So anyhow, the treatment given is still there. So not to worry about it. Yeah, it's just different from a certain economic perspective. Yeah.
Right. So thank you for that. After graduation, what do you all have to do in order to be a certified pharmacist? Because like I heard that you all have to take like some kind of exam, right? In order to actually be a certified pharmacist. Is it true?
So once you have done your degree, of course you have to pass. Of course, make sure you have the cert in your hands. Then after that you have to do to this one is for government setting. So I guess for private setting could be a bit different. So I'm just gonna explain in terms of the government. That's the only experience I had because that time they will only allow us to stuck to the government for the first year. Of course now they liberalize it, so it has changed a lot. The government side, after you got your cert and everything, then you have to possible try to sit for your law exam. There is the poison law exam for Malaysia one, in which include the Dangerous Drug Act. You can find the book in any law bookshop or bookshop. You have to go through 100 MCQ questions over 3 hours. You have to try to pass that. You have to get a score of at least 50%. There's negative marking as well in that paper, sadly enough. So every question you answer wrongly, they'll be deducted 1 point. However, if you answer correctly, it'll be 1 mark. If you don't answer, it'll be 0, but you need to get a minimum of 50. After you have done the test, then you will have to apply to the Lembaga Pharmacy website. Now it's done everything through online. After you got it passed, then you have to apply to the Suhan SPA for to get the job in the government, and then you wait for the post to come, and then you apply to the e-pharmacist website to get your next posting, and then from then on, yeah, that's the process. But I think these days the process is quite fast. I think you'll probably get your posting, I think earliest maybe 3 or 4 months after you graduate. I think now the process has gotten faster. Chok Tong may have different experience because he has done UK, Singapore, and Malaysia. Can ask him his experience.
Yeah, Tong, share with us your experience.
Yeah, so in UK style, during my time was once you graduate, you have to do a 1 year training I did in the retail sector. So I did 1 year in a Boots pharmacy. Boots is a community pharmacy. So during that 1 year, you are assigned a mentor who will assess you and guide you throughout your 1 year. And then things that they will be assessed is on your soft skill, your leadership, how you manage your team and all that. And then at the end of your 1 year, you will have to sit for an exam. And that exam, once you have passed it, you will be registered in UK Board of Pharmacy. They call it a GPHC. So for me, once I passed the exam, but I didn't continue to stay on working there. So I went to Singapore. They actually Singapore they don't recognize the 2+2 course, but they recognize my GPHC pharmacist board registration. So they allow me to work in Singapore, but on the condition I need to do a 3 months of training there to familiarize with the laws over there. And then at the end of that 3 months, I will have to take the exam, the law exam. And then once you pass it, then I'm registered in Singapore and allowed to practice there. Yeah. And then same thing when I want to register in Malaysia, I also took the law exam in Malaysia. And then when you pass it, then then you'll be registered. You apply for registration as pharmacist in Malaysia. Yeah,
Sounds
basically.
difficult. There were especially the 100 questions. And then there's the
Difficult,
negative marking
yeah.
as well, right?
Yes.
But not to worry though, even though it's it's under MCQ, may sound simple. However, it's open book, so you have 2 books to read on. One more tip though, those 2 books, right? You actually it's open book and you can actually bookmark the book for certain pages to find the answer. So it's you basically for the exam, you just need to know how to bookmark your book well enough to find the answer in 3 hours. And try to get 50 marks at least. Yeah, that's the point. If you can do that, then of course the 100 MCQ it shouldn't be a problem. But it's 3 hours, so it's roughly around 3 minutes per question. There's a clock in front of you, so you have to shut down properly every single question you can. If you're unsure, I say you skip the question as what you do in your A-levels exam. You just like skip it.
Yeah.
Next one, try and see which one you can score well. Yeah.
Okay, I actually have a question from a student of mine. Yeah. So this student is actually asking, upon completing the course, the student need to attach to the hospital. Like for example, they need to do like housemanship, just like those medical students. Upon completing the course, does the student need to actually be attached to a hospital? Is it a requirement in order for them to actually, be able to graduate from the course?
Wait, this question is actually for when they study in uni or
Study
while
unit.
they are doing uni. If uni, I think for the Malaysian prerequisite, they not required to do any attachment, but I think mostly will ensure there will be an attachment in the course itself. So I think at the end, everyone will be doing some sort of attachment by the time they graduate. It's
Or what
just
about after completing the course, Dave?
okay, if they complete the course already, okay, back in 2016 and before that, everyone has to go through the government and then they will be attached in the hospital at least, for at least a year. So that was the rule back in 2016 and before. I was that batch before. Yeah, I was in that batch. I was 2015 batch. Then 2016 onwards, they liberalized it. So in other words, they made all the students who graduated and they already applied to get the job, they actually can attach in the private hospital or even retail. As long they are listed in the Lembaga Pharmacy website, then they can actually work in there and do their housemanship in those facilities, which also include clinic kesehatan as well. So they kind of open up most places because I think there wasn't enough spots for all of them to enter. There was like a surge of pharmacy students, and the waiting time was can be quite long because during my time I'd wait almost 8 months. And over the 8 months, I was actually working in the cinema and also working in the retail for a while. Then only I got my job. So it was like a very long posting time. And then plus, if you have a long posting time, you could be quite rusty by then. So you might be forgetful and everything. So I think now they kind of shorten it to around 4 months, or however, it depends on how you apply your form as well. I think recently the government has improved the speed on how you can apply. How it's now open, you not necessarily go to the government hospital, you can do privately as well for your housemanship here. However, they have their own logbooks and you have to do the targets accordingly.
Okay, I think that's good. At least now you can actually do what do you call this kind of housemanship, not only in the hospital but also in retail. At least they actually open up more
Yeah,
places where students can actually go to.
you also can do industrial as well. So not to forget,
Industrial too.
but
Okay.
yeah, industrial too. So not necessarily
Mm.
it's just retail or pharmacy, industrial as well, or we call it the pharma side. So yeah, it's quite open up these days. So you can venture to other stuff. If maybe your interest is not in the hospital field itself, you can straight away join the retail or the pharma industrial side. Maybe you don't need to waste your time and like, okay, if you are very unsure, then maybe you can try out here and there. Anyhow, you still have to complete your 1 year housemanship to get your license. Yeah.
Choto, what about you?
I think the time when I just want to add the time when I was working overseas and I was considering to because I was planning to come back to Malaysia to practice. So my concern is, since I'm a pharmacist in overseas, do I still need to uh, when I come back here, do I need to work in hospital for maybe 1 year first before I get registered? At this point of time, you don't need that to do that 1 year. So if you decide to come back, all you need to do is to take the exam. Once you pass the exam, then you are a pharmacist here already at this point of time. I think previously you need to do when you if you decide to come back from overseas, even though you are overseas pharmacist, you need to do the 1 year
Yeah, you have to do sort of
attachment in
1 year.
hospital.
Yeah, it used to be the
Yeah.
rule. They do 1 year attachment or maybe a certain number of years working, then only they are
Mm,
sort of enter into the license. So yeah, I think short term sales too.
yeah. So I faster take the exam before they change the rule.
I think Choto has
Yeah.
took exam three different exams. Is it three different exams
Yeah.
to have three different licenses?
Three different registrations.
Two different registration. Yes, that's what you you told me the other day. Yeah, that was interesting. One in UK, the other one is in Singapore, and
Yeah.
one
One in Malaysia.
currently working now.
Yeah.
All right, so I have another question from another student. What else does a pharmacy do besides dispensing medication to patients?
So in the government facility, I think we are exposed to 9 different departments. So of course, the main one is dispensing, which actually we call it the outpatient department, where the patient goes to the clinic and then they see the doctor, they get the prescription, which is prescribed by the doctor, and then they give the prescription to the outpatient pharmacy, and the outpatient pharmacy dispense out the medication. There are actually other pharmacies involved as well, so not just the outpatient, which we commonly see in front of the counter. There are also the inpatient pharmacies, which is what I do. We are the one providing the medication for the patient in the ward, like now the COVID-19 patients, patients who medical patient, auto patient, surgical, ICU, eye ward, gynae ward. So we are the ones supplying the medication for them. Then we do have the drug information service pharmacists. We are the one where you have any queries or anything you want to ask. They are the one who will give you the answer based on their own references, of course. It's evidence based, most importantly. And then we have the therapeutic drug monitoring pharmacists. Therapeutic drug monitoring pharmacists, which we shorten it as TDM, which are actually pharmacists who sort of previously measured the level of the drug in the blood. There are some drugs where we take the level may differ to certain patient and another. So we need to keep monitoring them every single time, every few weeks or so on to see whether it's a gauge for the particular patient. Then there are also the TPN pharmacists, which are the total parental nutrition. They are the pharmacists who prepare the bags of nutrition for certain patients who can't eat, can't feeding or eat directly to their mouth. They maybe require infusion of nutrients into their body. So that's one of them. And then there's also the cytotoxic drug reconstitution pharmacies, which are the CDR. They are the one who compound the cytotoxic drugs for cancer patients. So they are the one who also will review cancer patient and prepare the drugs for them. And then we also have the compounding pharmacists. The compounding pharmacists are the one who prepare the syrups you may get from the pharmacy, or maybe the creams where they may compound it as well. Because certain creams you can't buy commercially, you need to be made specifically for certain patient. So those are one of them. Then we also have the clinical pharmacists. So clinical pharmacists are the one where they follow the ward rounds with the doctors and specialists, and they give their recommendation or any advice to certain patient, maybe it's renal adjusted, or maybe the availability of the drug, or whatever information where they can give the best service possible for the patient. I think I listed out everything I could already. Then there's also the logistic pharmacist, the one who purchased the drug for the hospital or KK. They are actually quite important people because they are the one who deals with the money and entertains the sales rep and making sure all the drugs are bought, purchased early enough before so that the patients can get it.
Wow, I didn't know there's so many roles that y'all have in the
Yeah.
hospital. Wow, on 9 different
Yeah.
types. In you are what, the in-house pharmacist?
Yeah, actually the inpatient, you're correct, the
Sorry,
inpatient pharmacist. Yeah.
inpatient.
Yeah. So,
Wow, wow.
yeah. So there are many
So
types, lah. Yeah.
so are you like at risk? Because now it's like, with COVID and everything, right? Are you like kind of at risk, working in a hospital, especially you need to
Oh,
meet patients and so on.
okay. So if you are in the COVID-19 designated hospital, then yes, it's quite risky, lah. I think you'll be handling. Actually, I don't handle directly the patient, but I'm the one who's supplying the medication. Even though I may not handle them directly, I do face the runners who takes the medication and supply the medication to the patient, which are the nurse or certain assistant people who will come and collect the medication, or maybe doctors as well. So yeah, it's quite high risk. Plus, my department is in the middle of all the COVID wards because now we have converted certain normal wards into COVID wards because the cases are like spiking every day. People are not following the SOPs. So yeah, it is high risk. However, because we are high risk, so we were given the vaccine earlier. So I took up a vaccine in around March there. So I already gotten my 2 doses as well. So I feel a bit safer, like you say. But at the end of the day, as long you just have to follow the SOP, wear your face shield, face mask every day. Yeah. However, there's some department may not be so high risk. Maybe if you're the one who compound the bags or you're in the compounding department, then maybe the risk won't be so high because you'll be staying inside the certain zone area, which you don't actually face patients. Oh yeah.
So talk what about the one in retail?
I think retail don't have only have one store, so don't have departments lah. So, but then again, pharmacies also not only involved in dispensing, they do a lot of managerial and supervisory roles. Got a lot of, for example, if a patient complains, patient returns, we have to deal with them. Then there's a lot of uh, what do you call things that get the pharmacy running. For example, roster. They do rosters. Sometimes pricing, depending on which working independent. Most likely you'll be involved in every single thing that pharmacy requires to run. But if you are involved in a chain, then maybe the process are already in place. The pricing also determined by HQ. You don't need to be involved in that. So not only dispensing alone, they won't give you such easy life. Yeah,
That's very true. Even though hospital pharmacy, I
yeah,
may be the ones to find out, but you have to do certain shift and you have to attach to certain departments. So yeah, they won't give you his life. Yeah, we also do
yeah.
certain manager role as well. Maybe set up certain admin work or collecting statistic or maybe COVID-19 patient with the key in the data as well. So yeah, it won't be so easy.
Mm.
Yeah.
So, okay, interesting there. Yeah. So, how does your role change over the years? Now you've been working for about a good 7, 8 years.
Hmm.
Is it
My sixth year working,
Seven.
six sorry.
6 to 7? Right. So, how's your role change over the years? Do you like get to pick, Dave? When you first graduate, when you are attached to the hospital, do you get to pick which department do you actually
Okay.
want to work in, or do they
So
just throw you straight into one department and you survive that?
yes, okay. Okay, so houseman, yes, you are required to, as all the pharmacies I told, there's 9 of them, I think I told. You have houseman, you have to attach all 9 of them over a period of 1 year. So, which is a good thing. You actually get to rotate each department and learn new stuff every single time. What you learn in 1 year may not be suffice. So, don't think that 1 year you will actually learn everything. Actually, as time passes, you will learn more. So, it's a ever ending process. Second year onwards, once you are kind of the qualified pharmacist onwards, yes, they throw you to any department they may fit you against, depending on the keperluan whatever the certain
Hmm.
situation. Yes, you can maybe request. I think the request is more suited for people who has experience. Maybe they transfer from a certain facility and coming in. I think, or maybe they have certain qualification. Then maybe you can request properly. However, I think people like us who are very new, I think they'll just throw you to any department and you try to make do with whatever you can. But you play responsibility on. I mean, by right, you've already been trained before in the 9 departments I mentioned earlier. So by right throwing you to any department, you have a certain amount of experience. Just right now, you have responsibility on handling the department itself. So yeah.
Okay. Chotong, how's your experience in Singapore?
Singapore initially, yeah, first year I think as junior pharmacist, you just doing the daily basic duties, dispensing, you do intervention calls to doctors, that's the basic duties lah. Then as you become more senior, about your third year, you start to be involved in team management. You become a team leader. Because even in the like I was involved in the outpatient pharmacy. They have a lot of many small teams inside. So I was involved in those billing, those charges. I think I was in a private sort of private hospital where patients do actually pay out of their pocket for their medicine. So yeah, we have a lot of billing issues that we need to solve. Insurance, we liaise with insurance companies, all those. Yeah. So uh, yeah, you start to be involved in team leader roles. Uh, and as you progress up the career ladder, I think you spend less and less time on the front line dispensing, more on the back end, ensuring that the front line is actually smooth. Yeah, so that is my experience in Singapore lah. Yeah, so far.
Seems like whatever that is that you're mentioning, right? A lot of things that you're doing right now is something that you cannot learn directly from the textbook.
Yeah, and
Yeah,
they won't tell you about it when you are studying.
they won't tell you about it. I mean, maybe the attachment you may know about it. The books are just
Yeah,
books. I think the bigger problem is the people involved in it. So yeah, that's another another problem itself. Yeah.
yeah.
Interesting. Yeah. So I think you pick up skills as you are on the job, lah, I
Mm,
guess. Mm-mm-mm. Yeah, a lot to learn. A lot to learn, even after graduating.
mm.
Road learning, right? Lifelong learning, right? So yeah.
Uh,
Okay, so there's another question from my student over here. Besides being a pharmacist, is there like any other jobs that they can actually venture into upon completing the course? If they don't want to work in the hospital, they don't want to work in the retail. Just now Dave actually mentioned the pharma companies. Is there any other career options for these students upon graduating from a pharmacy course?
I,
I think wait. I think there may be other types. Maybe the one who is trying to do the law related to pharmacy. I think we do have such a law. I'm not too sure. Is it a pharmacy law? I'm not too sure. I think there are other type of pharmacy lah. I mean the pharma side, which they can be involved, not necessarily the general hospital retail type. Maybe certain labs may require pharmacist experience, but I think those maybe just because they're quite similar with the bioscience field, maybe. So because our degree do have some overlaps with certain courses as well. So pharmacy course, maybe if they're not interested, they can venture into those field as well. So I don't know. Maybe you can ask Shopton.
I think they mentioned the law one is the regulatory affairs sector. Then I think if you can you can consider like being a lecturer in pharmacy course also. And those people who want to further their studies, they can do PhD research in pharmacy, medication. I think that will overlap with your the manufacturing side lah, in the like drug discovery and all that. Yeah.
Yeah, I think all this related to the pharma companies, isn't it? Right? I
Mm.
think there are quite a lot nowadays in Malaysia, right?
Yeah.
Quite
Mm.
a few that they can actually try, to work in. I remember that we visited Lembaga Pharmaceutical
Yeah.
Negara. Is it correct?
Yeah.
The one in
It was the
Pyro,
bureau. It was the bureau.
Bureau, yeah.
Uh,
Bureau, sorry,
Vivo
yeah.
Pharmaceutical back in 2010, 29, something around there.
We
Yeah.
went to, we went there for a visit, right?
Yeah.
I think as a whole class, if I'm not mistaken, along with a few other classes, a few other students as well. Yeah, so they can actually work there as well, right?
Yes, they can.
Mm.
They can. That's part of the farmer. Sorry, that's part of the government setting. So yeah, that's might be one of the location you may work. You can apply for it to go there, but not necessarily you may get there. That's a different routine. There is no. I think there is not major dispensing involved there. They are more towards regulatory of the drug, of checking the expiry, the validity of the drug. More to management side as well. That area, that facility is not the common one we should do in the hospital or so on. Yeah.
Okay, all right. So, yeah, I think there are a few options now besides being a hospital and also being retail. So, how's job stability? We have heard from Dave, who's actually in the government hospital for I think 6 years now already, isn't it? And then Chok Tong is in the retail right now. So how's job stability like? Maybe it's from Dave perspective first.
Okay. Job stability, I would say now the permanent staff. So yeah, for government life, yeah, it's very, very stable. But mine is very different though compared to now. So things have changed drastically since I entered, even though it was like roughly 6 years. In 2016 and beyond before that, everyone is required to apply a government job, whoever want to practice as a pharmacist. So back then, everyone will get the job, everyone will get the permanent offer. So it was very stable. The only way you could be out of the job is you really made you screw yourself up or you quit the job, which I think that is very, very unlikely as well. So back then things were very, very stable. However, in 2016 onwards, they have introduced the contract system. So the contract system means that all the pharmacists who entered the government at the time will be going through some sort of a probation service or housemanship for roughly 2 years or up to a maximum of 3 years, and they will be judged over the the first year performance actually. After 2 years, they will know the result whether they are absorbed as a permanent staff or remain as a contract staff. I think contract staff is where the part they are not so stable, because anytime the government may say, okay, you know what, we just want to end the job right now. But because you only sign a contract for at least 2 years, so after that, whatever they may do is they may extend. I think now due to COVID-19, they've been extending. By the end, there's some point they're going to stop anyway. So yeah, I would say I think there's a oversupply of pharmacists out there. So job stability now, if in the government, if you get a permanent job, great. If you don't, then yeah, you'll be kind of like undecided. You just don't know how your future will go on. And then later you have to venture to other fields, maybe the pharma field or the retail field. So yeah, I think job stability now is not that great as it used to be.
Which I think the experience from the attachment and placement is important, right? At least that if you don't get a permanent job in the hospital, there's always like retail, there's always pharma companies, right? There's even research that you can actually do, right? So don't, what about in retail?
I think retail also currently is also quite stable, unless like you decide to quit, or you screw yourself out like that. Dave said. uh, yeah, but I think uh, there's not much like, because from contract pharmacies, they current situation, they are unable to extend the contract, so it's like pharmacies overflowing out, so they will have to resort to other fields. The current situation looks like retail pharmacies. I think they are currently expanding, so the job opportunity is there. So I guess once you manage to retain the job, I think it's quite stable already from then on. Yeah.
Okay, seems to be all right, right? Uh, okay, any interesting experiences you all want to share from your working life so far?
My interesting one, I think it'll be probably the most recent one, the COVID-19. I don't know. Since I came to Sarawak in 2016 up to now, I think I've seen many kind of pandemic has happened or whatever. I think I had like the rabies one. So
Yeah.
that time we had to handle a few different type of rabies situation where the vaccine, the immunoglobulin, the kind of treatment needed for certain patients which were bitten by the dogs and didn't get their treatment early enough. That was like probably roughly the first 2 years, like 2017, 2018. Then I thought like 2019 will be okay. And then this COVID-19 happened. So I think the interesting experience was when we did the COVID-19, because that was the time when the cases start spiking in 2020, when we had the first MCO. And then there was some staff infected. So we had to resort to certain ways of supplying drugs, and how we work as well had to change a lot. We had to do certain way where we team base ourselves, because we couldn't like make everyone work on the same day. What if someone's infected, then everyone else had to go 14 days of quarantine, then there'll be no one working in the pharmacy, and the patient can't get their drugs. So I think that was one of the most interesting experience I had so far. We work in a team base and try to understand how other department work. So we had to do other jobs as well. Then I think the most recent interesting one is the one supplying of vaccine for the patient these days. So currently now we're doing for the prioritized patient. So I guess last week I was working on the vaccine duty. So how we take the vaccine from certain facilities, and then how we take it from the cold box, how we thaw them, how we monitor the temperature, and then try to ensure no wastage, and then giving out to the patient. But of course, we are not the one injecting it, but we get to see the whole process involved. It's quite a mega process now. I think for my side as well, they're aiming it to complete by August or so. So I think that's one of the most intense experience I've had so far. Yeah.
So you hear that for those who are listening right now, right? So you hear that not only the doctors and the nurses are the one working hard to actually fight this COVID-19. There's the pharmacist as well who's actually fully involved in this process. So please, try to cooperate with all of them. Make their life a bit easier, right?
Yeah.
They've been working very hard. Now cases are spiking. So take care of yourself. Stay at home as much as
Yeah,
possible,
stay at home,
right?
stay at home.
Stay at home, stay at home. So they've done so much. So if you see them, just give them a very big thank you, right? Because they've been working so hard. I know Dave has been very, very tired, working non-stop, I think, since the pandemic has started.
Sort of every day. There are some day off I had, but I really didn't work as hard as the nurses and the doctors. I mean, really, those are I really have good respect, and they can work a 12-hour shift. 12 hour shift, and maybe they don't even meet their family. Okay, I still haven't been a very, very long time, but they go for 12 hours and they maybe get quarantined in a certain location first, and then they continue back to work and continue and wear the PPE every single day. I think that's a major challenge. I think for pharmacy, still pretty good, I would say. But how about there are some pharmacy involved where they have to go out there and the temperature of patients, so they may have to wear certain PPE. Maybe not the place I'm working at, but there are other places where pharmacy are also involved in other stuff as well.
Mm.
So, Jotong, any interesting experiences?
I think for me, retail setting not as interesting as hospital. For
Singapore, what about our experiences in Singapore? You had
Singapore,
2 years there, right?
5 years.
Oh, 5 years. Sorry. Yeah.
Singapore. Yes. I think the most memorable one was when I had to interview, because when the patient is warded, when they just entered the ward, we have to take their medication history. So we have to interview them. So there's this patient that that cannot speak English. So the only way that he can communicate is in his own mother tongue, which is he's a Thai patient.
Oh.
So so I had normally in the hospital they have translators, but because it's already uh, after office hours, so the translator has already gone home. So there's no way of communicating with him, and the nurses in the ward also, they don't know how to speak Thai. So I had to use Google Translate from my phone, and I have to word it in a way that he he answers in a yes or no question, because if he if he answers anything in Thai, I cannot understand what he said. So so I had to word it in a way that he shake his head, or not his head, or shake his head. So that was a very memorable experience for me. Yeah.
Yeah. Wow. Surely something that don't teach you in the textbook.
Yeah, yeah, yeah.
No.
Sorry, that was my son. Okay. All right. So yeah. Okay. One question. One question right now. So pharmacy, right? It's basically pharmacists out there. Um, there are a lot of, I mean, female pharmacists out there compared to male pharmacists. True or false?
It's very true. I think for my
Yeah.
course itself,
Yeah.
10 males out of 50 students, so 40 are females. And then when I went through my compulsory service, I would say 90% are females. But I wouldn't say like only pharmacy is having this problem. I think medicine field also has, or even nurses as well. So there's definitely a higher portion of female. I think it's already proven otherwise, because during my vaccine duty, they already kind of divided the number of stations for females and males. So there were like 6 stations for females and only 2 stations for males. So I'm pretty sure, there's a lot more females out there for, I don't know, the health field, I would say. Yeah.
Yeah. Okay. Yeah. What about retail?
Retail also, majority is female. Yeah. Majority is female. So male is severely outnumbered.
Extinction, they call it.
All right.
Extinction.
Yeah. I think the population also, it's in such a way that whereby there are more female right now, isn't it?
I just think males just doesn't pick the health field that much, whereas the woman does. And I think not only that, I mean, I think these days, I think there are more women in the university as well. So I think there's a higher portion of ladies in the university, which will reflect to the workforce as well. I think the only imbalance probably you only see probably is engineering. I think engineering is the only time you will see there's the high spike number of guys and there's like a few number of girls. But if not engineering, I think anyhow, I think even the business field, there'll be definitely more girls out there. Yeah.
Okay, all right. Okay, so I think we come to almost the end of our session today. We're running out of time now. Okay, so let's wrap things up. So, any last advice you want to give to our listeners out there? It could be students, it could be prospective parents as well, right? Any last advice you want to give to them? Just to like maybe if they're those who are thinking still whether to apply for this course or not. What advice you can actually give them? To reaffirm their stand, that reaffirm their interest to actually take up this particular course.
I think for people who are interested to take pharmacy, I think you need to look at yourself definitely, and then if can try to ask as much people you know. If you're really interested in take pharmacy, try to ask as much people you know who are in the field, get their opinions, and try to take it in. And then if possible, take initiative to do certain attachment. Okay, maybe if you are doing in the university, you have attachment. Okay, before entering university or before you want to do the course, you actually can make your initiative and work in a retail pharmacy for a few months and gauge yourself whether you like the environment or how you've been doing. However, don't judge it by just one working place, because if you're just doing retail only, then of course that's the only experience you have. You haven't included the hospital field or maybe the industrial field and all that. So I think if can, you try to get as much experience and opinions as much possible, and don't have that mindset where, oh, I can make a lot of money in pharmacy. I think if you have that mindset, it's not going to work very well. So it's really about the passion, your mindset, your mental fortitude to handle the situation, the patient out there. I think the exams in the uni are just a control situation. I think everyone has a fair shot of doing it. I think it's not people who fails a pharmacy course as well. So in general, most of the time people will pass it towards the end. It's just whether you get your first class, second class, so on, whatever. The end, everyone starts off the same. So regardless, you come first class, third class, they're going to see you as equal still. It's just about how you perform well. So if you really want to consider pharmacy, yeah, I think it's better to read up and see what other people think about it, and then see whether it suits to your personality or not.
Yeah, yeah. Very, very true. You have to actually listen to a few different sources, right? For those who are listening in right now, yes, you have actually done the correct first step, which is basically to listen to both our pharmacists here. And two different views. One is from hospital, the other one from retail. But besides that, after this particular session, continue to seek more information from, maybe it could be from relatives of you who are actually working in the pharmacist, or like what Dave actually mentioned, better still, if you're in the PU level right now, maybe we're doing A levels right now, during your break, just go and get attached to the retail pharmacy that you have outside, or if you can, I don't know whether any government hospital would accept
I think
any PU attachment.
government hospital, I think they accept pre-U student. You just have to have an application of approval that you are actually a pharmacy student. Then actually some hospital may accept you and they may give you a roster to attach certain departments. However, you may be not so involved in the patient wise, just behind the scene a bit more, but you get to see how it's involved.
PU students can,
Pre-U students can, we do have some of them we attach, but it's just for their experience sake. I just gonna say that they won't be the one facing the patients, because we only can have qualified people facing patients. So they're just the one who's like, okay, you are there, you see how the workflow, see whether you like it or not. So some hospital may accept it. However, you need to have certain approvals.
Hmm.
Yeah, so very important to actually hear from different sources and the best experience it yourself. Chotong, what about you?
I
Any
think
advices?
no matter what course you choose, most importantly, you have the passion and you have a strong reason why you want to do it. Not because your parents ask you to choose the course, or because all my friends chose it, so I just follow them. You must want to do it because you are interested in it, and it's your own interest to choose the course. And then the next thing is to choose a reputable institution, because the last thing you want is after you graduate the course, the degree that you obtain from it is not recognized anywhere. So make sure the university you choose, the degree that you're going to get from it is you will be able to use it to obtain a job lah. Yeah. So yeah.
Thank you, Chotong. I think very important. You must really have passion in doing a course like this, because at the end of the day, you're going to be facing actual human, actual person.
Yeah.
Right? Yeah, you're not going to be dealing with just not dealing with just the medicine itself, but also somebody who actually talk back.
Yeah.
Mm.
So is your colleagues one of it? The aunties and uncles. Basically, you're not going to be entertaining every single time educated people. So you're going to handle the
Yeah.
layman people. So you got to prepare that. And of course, the environment where you work with, certain colleagues you may work with, or maybe certain bosses you have to deal with. So all of this, yeah, it's something you can't learn from textbook. It's all based on experience, and sometimes you crash and burn, but you learn a lot of it. So over time you will get better, and hopefully you learn from all the experience you had so far.
Okay, all right. I think we have heard a lot from you guys. Thank you very much for your time today. All right, because this particular session, I think, is the first of our series. So we'd like to introduce the course that is available for students actually doing tertiary level. And I'm very happy that both of you are sharing a lot of experiences in the government sector as well as also in the retail sector. So again, thank you very much for your time. Thank you very much.
Yeah.
Okay.
So yeah, so if you have more what they call this queries, or if you have questions to ask, please put down in the comments right below. Right, I will be sure that to ask Dave and also Chakton to answer them, right? If they're actually valid. Yeah, so please
Uh,
put down in the comments. Yeah, so if
yeah,
you like what you see and what you hear today, please give us a thumbs up, subscribe to the channel, right. So also, if you want to listen to other career options and maybe different courses as well, please put down in the comments right below. So again, thank you very much, all right, for your time today, right, Dave and also Chatong. Be hoping to hear from you again, right, maybe for a second part of this episode.
yeah. Call
If
us
you
back, bring us
hear
back.
more,
Just comment and say more.
if you want to hear more from Dave and Chakton, please put under the comments right below, right? So I will invite them again for maybe a continuation part or part two of this particular episode, right? So thank you very much again, right? I'll see you guys in the next one. Bye bye. Take care.